I want to bring in someone who has been directly impacted by these changes. Emergency physician Dr. Debra Houry, former CDC Chief Medical Officer and Deputy Director for Program and Science. So a perfect guest to get through this difficult subject matter because so many people have questions. So many people are worried, those who are pregnant, wanting to know what's going on. So first, let's start with your thoughts on the Tylenol business.
So on the Tylenol and autism link, there have been studies that have shown really no association. Some have shown an association. When you look at, ones that look at siblings and are really well done, there's not an association. So I don't know what data the secretary has and if it's a larger data set. We weren't involved in that study, but right now I would go with what the American College of OB/GYN is saying, ACOG, and Tylenol is okay in pregnancy. I think there's many things that could be linked to autism. We know it's not a single thing. And so I think that's what's important for the American public to know, is that there's many different causes that could be contributing to it.
Sure. Okay. I also wanted to talk to you about your job or former job. You recently resigned from your position in reaction to Secretary Kennedy's vaccine policy. So I'm hoping that you can share what events led up to your decision to resign and what was the breaking point for you to make such a difficult choice. Was there a straw that broke the camel's back, so to speak?
I'd say there were probably a couple of straws that tipped me over. And I just believe in gold standard science and transparency, as does President Trump. And so for me, when we had done a document on an additive in a vaccine called thimerosal, and the secretary's office instructed us to take it down, I didn't think that was helpful. The American public needs to see that data and help inform their own decisions. And with the recent upcoming vaccine committee meeting next month, some of the decisions seem to have already been made before we've even given them the data and the science. And so that concerned me. I'd say things like that are to where I believe in data and science, and that's what should drive recommendations and not ideology or opinions. And so I care about the safety of our public and needed to step down so that I could say this out loud.
Sure. I mean, did you have any wiggle room, though, to try to go back and make some changes before you pulled the plug?
Yes, I'd say over the past few months, myself and Drs. Jernigan and Daskalakis had worked through our scientists to try to make recommendations to continue to keep them science-based and to put the data out the best we could. But over time, it became clear that agendas were being driven more by the department than by science, and needed to take a stand, including when our director had tried to make a simple staffing decision and didn't want to preemptively sign recommendations, and she was fired as a result.
Yeah. All right. Well, we can understand that. Secretary Kennedy also received a lot of pushback from both sides of the aisle this week, particularly on his changes to vaccine recommendations. I want to play some sound of what he had to say this morning. Let's listen.
My job is to shake up the organization, to fire the people who are responsible for masking our children with no science, for social distancing orders with no science. All of those senators are taking hundreds of thousands of dollars, including, in some cases, millions of dollars from the pharmaceutical industry, so they don't want to hear the answers to the questions that they ask me.
All right, so I'm just wondering, what do you make of his criticism of senators who may have ties to health companies and what he deems as his role in all of this?
Yeah, a couple of things around conflicts of interest. It's certainly important to always make sure we know what they are. But with the new vaccine committee that the secretary has put together, he's also put people on the committee that are expert witnesses against vaccine manufacturers. And to me, that's also problematic. And just clearing the air, he talked about getting rid of the people at CDC who were there during COVID. I never actually had the chance to brief the secretary on anything, and I was running President Trump's drug overdose strategy at that time, and two of the other senior leaders who stepped down with me weren't at CDC during the beginning of COVID. They were in local health departments. This just goes to, having those conversations with the secretary so that he knows what his experts and scientists were involved in. And we just were never able to brief him on measles or H5N1 or even vaccines. He would have been better prepared for the hearing if he had listened to us.
Right. I mean, that must, it sounds like there has definitely been a lot of frustration. So we'll see what happens with your career next, and we'll check back in with you. And I appreciate you coming on the show today. Former CDC Chief Medical Officer, Dr. Debra Houry, thank you very much for joining us.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.